experts are advocating for improved researching ability to enable accurate and precise information dissemination, especially on COVID-19 reportage. Unicef communication specialist Geoffrey Njoku gave the charge in a presentation titled Health Journalism and Ethical Reporting during the two-day annual health conference on COVID-19 reportage assessment organized by the Association of Nigerian Health Journalists, Aotabale, Nasarawa State. He said about 72% of Nigerians do not believe in COVID-19 due to lack of research, hence causing low adherence to COVID-19 preventive protocols in the country. The Conference of Health Journalists, which had a series of engagements featuring sexual and reproductive health amidst COVID-19, is aimed at setting agenda for media practitioners to be abreast on how best to educate the masses on issues of contraceptives, as more than 3,000 women die yearly due to unsafe abortion, as well as the countless number of persons that survive with life-threatening complications, especially with infertility, thus resulting in loss of the womb.
Steps that we can adopt that we're able to cover COVID, because COVID is a difficult issue today to cover. But look at this data, it showed the presentation, we showed during the presentation, the fact that people don't believe, people are skeptical. People believe that some of the measures, hand washing, social distancing, that they are all difficult. So the first which we have, like the data says, if you have 72% of Nigerians not believing that there's COVID or it's a threat to them, we have a big problem. How are you going to reach them? So we try to point out to the media that there are strategies and things you can use, tools that you can use to try to make sure you understand how to reach that your audience, basically. So we probably there are 4 or 5 things that you can use. We talk about research, about knowing your audience, the subject matter, about how can you mix them, what's the nexus between the issue and platforms that we can use. That's basically what it's all about. Just trying to get additional skills that they can use to improve what they are doing, because we are all trained people, we know what to do. We just say, okay, these are latest findings in this area, which you can also apply.
Also, Head of Risk Communication, Nigeria Center for Disease Control, Ncdc, Yahya Disu, noted that there is a need to collaborate with the media to tackle misinformation in order to ensure total compliance to COVID-19 protocols for immense elimination.
We have been getting data that show that Nigerians don't believe in COVID-19. I think what media can do is to continue to report, pass the message consistently, because we know behavior change takes a while. Another important thing is how we report it is also important in such a way that they will understand the messages we are passing across. And misinformation is also another big challenge that is diluting the effectiveness of our messages. Maybe what we need to do is to all of us to work together to build individual and community resilience to misinformation. That way, we'll be able to ensure that our messages are understood and the behavior change we're trying to achieve is attained.
Meanwhile, on the issue of sexual and reproductive health amidst COVID-19, the Marriage Stops Nigeria Head of Communication and Marketing Specialist, Ogechi Onoha, stresses massive education to achieve modern contraceptive method among the citizens, adding that Nigeria, with its low percentage to attaining the 27% target on family planning, without adequate collaboration with the media, achieving poverty eradication would be unattainable as key to national development.
My organization would believe that children should be by choice, not chance. So childbirth is not something that should just happen to you. Nigeria has a target to reach 27% modern contraceptive prevalence by 2020. However, the projection by the FP 2020 analysis is that 9%, based on the estimates at 14% by the end of 2020. A lot of progress has been made seeing where we were and where we are currently. However, we are not yet where we are looking to be, and more needs to be done to get us from where we are currently at to where we are looking to be. And what are those ways that will get us there? One is massive education of our communities, of our population on the benefits of modern contraceptive methods. Why is family planning important? Family planning is important because it helps the family space their children. They achieve their intentions in terms of number of children they want to have, but then they are spaced appropriately. And what does that do? It strengthens the health of the woman, the health of the children, the health of the family. It helps the woman to stay in education, the girl child stays in education. And also, it helps them contribute to the productiveness of the economy as against threatening poverty. So family planning is very critical, and what we can do as individuals in the immediate environment, as a media group, let's put the information out there so that people understand the value of contraception and why it is beneficial to them and to the society.
Thereafter, Ogechi further urged parents to give their best to their children by educating them on sexual reproductive health at every stage in life to prepare them in choice making, thereby preventing unplanned pregnancy among teenagers.
The best way to educate a child and to prepare a child for future in terms of sexual reproductive health is to educate that child. The way we send our children to school to go and study and become empowered to make informed decisions and be productive, that same way we should educate them on their sexuality, on their sexual health, so that they make informed decisions. They're able to make their choices to prevent unplanned pregnancy. Using those crude methods of testing is because those parents have not done what they should do. And evidence has shown that children who have been exposed to sexual health education actually delay the onset of sex, as against those who have not been exposed to it. Development age varies with children, but at the moment your child begins to ask certain questions, let's not shy away from answering those questions. Once the child begins to talk and ask certain questions, let's provide age-appropriate responses to those curious questions they are asking. But the moment we begin to shy away from them and defer them, we are not being fair and nice to those children. We are leaving them open to misconceptions, to peer influence, which their peers might give them the wrong information. But as they ask us questions as mothers and fathers at home or as relatives at home, and we provide the right age-appropriate information that will answer their question at that level or at that age, then they trust us to come back next time they have such questions to ask and not turn to their peers who are outside for such questions.
The theme of the 4th Annual Health Conference is COVID-19 Reportage Assessment, aimed at encouraging journalists covering the health beat to engage in fact-finding to meet the target audience. In Nasarawa, Vincent Okushi reporting.